Thank you all for joining us, especially on short notice for a very important media event discussing end-of-life issues concerning the COVID-19 pandemic. New York State began registering deaths in the state in the late 1800s. Section 4140 of the Public Health Law designates the roles and processes established to register a death and arrange for a disposition of the body. As of 1953, the death of each person who has died in this state shall be registered immediately and not later than 72 hours after death of the finding of a dead human body. The state records these deaths in the Electronic Death Registration System, or EDRS. This is a secure web-based system for healthcare providers and medical certifiers, medical examiners and coroners, and funeral home directors. All cases with a matter of death that is not natural are referred to an authorized medical examiner or a coroner within the jurisdiction where the death occurred or human remains were found. As of November 30th, 2020, just last week, the state of New York enacted a new requirement for coroners and medical examiners who, upon reasonable suspicion that COVID-19 or the flu was a cause of death, a test must be performed within 14 days prior to the death in a nursing home or hospital, or by a hospice agency, or the coroner or medical examiner shall administer a COVID-19 test within 48 hours after death should a test not have been performed prior to. These results by the coroner or the medical examiner shall be reported to the Department of Health. In the early days of the pandemic, in March and in April, the federal government had to rescue us in New York City by sending 85 refrigerated tractor trailers to the New York City hospital system for temporary mortuaries. In Franklin County in April, the county began to obtain refrigerated trucks that could be used to supplement morgue capacity in its healthcare and hospital system. In April, Suffolk County had to convert an unused meat processing plant at the Suffolk County Farm into a temporary morgue. Just yesterday, Monroe County Executive Adam Bello mentioned that with the surge, the County of Monroe has seen more deaths and is opening a temporary morgue that can hold up to 20 bodies, similar to the one it opened in the early days of the pandemic. How do we maintain dignity in the end of life? We need resources. We need federal resources. We need a dedicated personal protective equipment supply channels. We need regulatory, Department of Health, surge and flex, not just for emergency frontline workers and healthcare workers, but also end-of-life healthcare workers to allow flexibility when and if a surge of COVID death occurs. This is a mass fatality pandemic. Let's make no mistake about it. County officials every day are literally processing dead bodies resulting from the COVID pandemic. We are paid for this. It's our job. But society owes it to the end-of-life care workers. It's our societal moral obligation to ensure dignity with death remains sacred. It's our obligation to provide resources for personal protective equipment are provided, disinfectant equipment for the bodies, body bags. Not every New York County did receive COVID-19 federal relief. This means that most of the New York counties could not properly fund and supply resources for the coroner and the medical examiner offices or support the needs of the funeral home industry. New York State did the best it could with the limited resources that it had. We need a federal partnership, a strong one, not just for frontline healthcare workers and essential workers, but also for our end-of-life workers, the coroners, the medical examiners, and the funeral home directors. Congress is debating as we speak as to whether or not they'll provide COVID funding for the state and local governments. We urge the Congress to set aside partisan differences in the best interests of all Americans. I'd now like to recognize Scott Schmidt, the Orleans County Coroner and the president of the County Coroners and Medical Examiners Association.
Thank you, Steve. And thank you for bringing to light the fact that this pandemic is a mass fatality incident. And a mass fatality incident, by definition, is one that overwhelms your resources in your county with regards to normal events surrounding deaths. Certainly, this global pandemic has overwhelmed resources in every county pertaining to deaths, some more than others. The system in New York State, as far as medical legal death investigation, is a twofold one. It is a medical examiner system and it is a coroner system. Home rule in New York State allows each county to do things differently, however they see fit, which is best for their county. And that affects how we operate. And while our association statewide encompasses many of the coroners within the 62 counties, not all of them belong. And so there are differences throughout the state where we wish it could be standardized. It isn't. And we run into difficulty because of that, but we run into more difficulty because of the similarities that the medical examiner's offices and the coroner's offices have financially. The coroner's office, in most counties that have elected or appointed coroners, receive their funding from grant money through the public health department. They aren't top of the list when it comes to county budgets. Some counties, they aren't on the list at all. So in the coroner system, on that side of things, most of the coroners are full-time employees at other jobs. They do the coroner's job as a part-time gig. Most of those coroners receive their supplies out of their own pocket when they purchase them. It wasn't until this past spring in Orleans County that we received gloves, a cache of N95 masks, and some personal protective fluid-resistant vests and coats to wear on coroner-specific cases. If I wasn't a funeral director, I wouldn't have access to some of that stuff the way the county stands right now. And it isn't the county's fault. The county just doesn't have the money to provide that kind of equipment. On the medical examiner side of things, they're also funded through most of the time through a public health department. And what is the first thing the public health department does when they need to cut their budget? They go after the medical examiner system, which is already overwhelmed with unattended deaths, homicides, suicides, any kind of deaths that are investigated. They're short-staffed. There is a shortage of medical examiners throughout this country, let alone New York State. So their supply chain, while it may be effective, is also compromised because of funding. And funding is a huge thing. If you don't have funds, you can't purchase the equipment you need. And as a coroner, we are charged, as well as medical examiners, for determining cause and manner of death. If we don't know a person is COVID positive out in the field on an unattended death, or in a car accident, or on a suicide, or in a homicide situation, we go in there blind. And if we don't have equipment, we expose not only ourselves, but our families, our coworkers, our colleagues, our coroner transporters, which 90% of them for coroners are our counterpart funeral directors. The funeral directing industry and the coroners and medical examiners work hand in hand. And we watch out for them, they watch out for us. And for the most part, we couldn't do our jobs effectively without our funeral director brothers and sisters. Funding is hugely important. This latest directive about coroners having to provide a COVID test within 48 hours sounds like a great idea, but who is going to pay for those tests when in Orleans County, up until recent days, we haven't had any ability to test anybody here in this county, period, let alone give the coroner a test kit to take out to an unattended death. A, who's going to pay for it? How are we going to obtain these tests? Are we going to be trained in how to do them? Who's going to pay for the training? What happens when we take the tests? Who gets the samples? Where do we send them? How's that money going to flow to us to get them to where they need to go? Who's going to pay for the testing results to get back to the people that need it? And then what are they going to do with it after they get it? Is it just going to go into a statistical stockpile? It risks our lives. It risks the lives of our coworkers. in our friends and fellow colleagues and professionals in the business of medical legal death investigation. And I'll even extend that to the organ and tissue procurement people as well. They don't know if this body that we're investigating is COVID positive or negative. If they're not in a hospital or a nursing home, we've got a crapshoot going on. And if we don't have the equipment, I don't know how much longer I want to do this job, putting myself at risk for this kind of a virus, at the way the fatality rates are going.
Thank you, President Schmidt from Orleans County, the Orleans County Coroner, who's been in this business an awfully long time. That's something for you to make a remark like that. Let's go to Robert Cole. Dr. Robert Cole, a retired surgeon, spent his life in healthcare, continues to dedicate his life in public service. Dr. Robert Cole, the Steuben County Coroner and Vice President of the New York State Association of County Coroners and Medical Examiners. Dr. Cole?
Thank you, Stephen. My perspective is that, as you said, as a retired physician, retired general surgeon, who's also an elected coroner in Steuben County. We have 4 coroners in our county. We're a rather large county geographically, but rather small from a population point of view. 97,400 people live in the county. It's mostly rural, although we do have Corning Incorporated has its home in Corning, New York. So we do have that presence in the county. My own experience through this COVID epidemic has been seeing an increase in drug deaths. I've seen an increase in deaths from chronic conditions when patients were not able to go back and see their providers last spring and early summer because those offices were closed due to COVID. And so routine follow-ups did not occur. And those routine follow-ups in some people were quite significant. Those follow-ups were missed and there were some deaths due to that problem. The other thing that I've seen an increase in is in suicides. And I think that the other 3 coroners in the county have experienced the same thing. And I have no reason to believe that this is not going on around the state. A problem with increase in drug deaths, chronic conditions are getting worse, and suicides. In the future, it's predicted that we will be seeing more deaths from cancers because people are not responding and going in and getting screening tests done, like mammograms, like colonoscopies, other endoscopies, chest x-rays, CT scans. They're afraid to go into hospitals. They're afraid to go into doctor's offices because of COVID. So over a long period of time, we will probably see an increase in mortalities from those conditions. And already nationally, our longevity rate has gone down. Males and females are not living as long as we expected to live just a year or 2 ago. In the future, we're all waiting and hoping that a vaccine will be distributed to New York State. We understand some is on the way and decisions have been made to deliver that to healthcare workers on the front line and people in nursing homes. And we also think that it's very important, as Scott has mentioned, that if a vaccine comes out, that coroners, medical examiners, and people who actually go to the scene and handle deceased patients be protected with a vaccine when that becomes available. And even with the vaccine, I think everybody in the state needs to recognize that we need to continue to wear masks, we need to continue to practice social distancing, and we need to continue to do hand washing. Being immune to the coronavirus does not necessarily mean you can't carry it. And this is one of the unknowns. We haven't figured that out yet with the vaccines. So with time, we will understand that. But in the meantime, even if you get the vaccine, you need to practice social distancing, wear a mask, and wash hands. Thank you.
Thank you, Dr. Cole, for the precautionary words of wisdom that you shared with us. And thank you, Scott Schmidt, for your work, both of you attending funerals and being very involved in those today. We appreciate your time that you were with us. Mike Lenati is the Executive Director of the New York State Funeral Homes Association, Funeral Directors Association. Mike, your membership very busy in 2020. That's not a good thing. Processing the amount of human beings and making sure that dignity with death remains paramount. You've been through hell. Your members have been through hell this year. What are the needs of the industry? What are you seeing in New York State, all around the state? And what do your members need at this point in time as we enter the second phase of the great pandemic?
Thank you, Stephen. I appreciate you including the funeral directors in the conversation. As I know you know, and Scott and Dr. Cole know, funeral directors are part of the death care industry. As a matter of fact, many of our members, as Scott actually alluded to himself, are funeral directors. And we work very closely with the coroners and in our jobs. You're exactly right. When the first wave of the pandemic hit New York in the spring, especially in the downstate region, the conditions deteriorated very quickly. We were in a reactionary mode from the jump. And the best way I can describe it is it was a combination of a war and apocalyptic movie. That's really the kind of scene that we were dealing with. What I like to do, funeral directors really serve two roles. They have a public health officer role in dealing with the deceased, and they also have a support role for the families who've lost a loved one and take great pride in helping families and the loved ones through those first initial stages of grief. What I like to focus on right now is the public health role that they played. So I think the best way to answer your question about what the needs will be is to take a snapshot and a quick look back at what they went through in the spring. The death care system had several stress points and pressure points in the spring. And they were really in four key areas. The first was something you alluded to in your opening, which was the need for an adequate supply of personal protective equipment, or as everyone refers to it as PPE. We had our funeral directors reaching out to us almost immediately as supplies, especially downstate, started to run out. We were thankful that we had some funeral directors who weren't in other sections of the state who weren't hard hit, able to donate supplies to the hard hit areas. But as we know, the second wave is not just located in downstate New York, so we don't anticipate that happening. Our funeral directors were trying to secure adequate supplies of PPE. They were very hard to come by. And when you could find them, the price had now tripled or quadrupled, or in some places tenfold. So the cost to even secure them, if you could get them, was astronomical. The time delay was very unfortunate and difficult to manage as well. To try to explain even how we tried to help, our association went out and purchased nearly $250,000 of personal protective equipment just to try to help. So that's just one piece of the financial resources that our funeral directors needed to try to get by. Another area of stress was the morgue capacity issue. What I like to talk about when I speak to that issue is really what I call the time factor. As we've talked about, as you alluded to, it takes a certain amount of time from the point of death to a burial or cremation to do the process with dignity and respect. When we were dealing with the surge in April and May, we were dealing with nearly 800 COVID deaths a day, when normally in the state we see 425. And those deaths, as we know, were concentrated downstate. But the math just didn't work. We were quickly seeing that we didn't have enough time to handle the number of deaths from the process of when someone passed away all the way through the burial cremation. The cemeteries were backlogged, the crematories were backlogged. And it just became a significant concern to make sure we had more capacity, temporary storage, until we were able to work our way through the process. What happened? Thankfully, after a delay, we were able to have some morgue facilities set up in locations downstate. But we had funeral directors who actually went ahead and purchased refrigeration units out of their own pocket to ensure that they could help meet the family's needs and the demands that their community had because of the unprecedented number of deaths that they were seeing. We also had a corollary impact to that, which I call transportation, and that dealt with trying to get decedents to their different places out of the hot zone of downstate to different crematories. We had funeral directors that needed to get people to upstate New York, to other neighboring states for cremation. That came with an expense as well. We had some who had to rent and buy vehicles. They would have to travel to these other locations, have staff who would help them. They also had, in many places, just didn't have the capability to do that quickly. So we actually had funeral directors from other parts of the state go downstate and help out by doing transportation services for them. That was, again, a resource that was helpful, but it cost money. And our association's foundation reimbursed those who volunteered for that expense. The last piece that we saw in terms of stress was simply people power. We ran out of folks who were able to handle the number of deaths. Thankfully, through an executive order, we were able to bring in funeral directors from other states to help us. But as we all know, as I mentioned earlier, New York State was the only one, or the Northeast was the only area really being hit hard. Now we know it's all over the country. You know, there just aren't those folks who can come and answer the bell if we have that need again. So there will be a need to bring people resources in. Again, where those are coming from, who's paying for those resources is all something that we're going to have to figure out. So whether you're talking about securing PPE, people resources, transportation, additional morgue storage, it's all going to cost money. We need to make sure we have those adequate financial resources to be able to cover those expenses and get those resources so that the entire death care industry is able to perform their very important public health role. And again, specifically as it relates to the coroners and medical examiners, every unattended death, they're the first ones there. So if we don't have the resources for our coroner and medical examiners to go and pronounce the death, they can't then turn over to the funeral director for them to be able to do their job. So we support all the efforts that are being undertaken. We applaud you for bringing this to everyone's attention, and we stand ready to do our part to ensure that we get the funding that we need so that this job can get done.
I'd like to thank all of the speakers on today's press conference. This is Mark Levine. I'm with the New York State Association of Counties. This is now the question and answer period of this press conference. There are two ways to ask a question. You can either type your question into the chat box on the Zoom dashboard, or you can put your cursor over the more next to your name and raise your virtual hand, and we will unmute your line. So I'd like to take any questions you may have at this time.
Mike, this is Scott. I'm going to ask you a question and see if you possibly would agree with me. Part of the reasoning that there was such a backlog of human remains to be disposed of accordingly and appropriately early on was because of the fact that there wasn't enough crematories in New York State that could handle the volume of bodies that were actually piling up, if for a better term. And would it have been helpful, and will it be helpful going forward if the New York State Department of Cemeteries and Crematories relaxes their guidelines and their rules and allows more crematories to be built in this state so that we have access to that particular product when we run into situations like this pandemic?
Yeah, and I think even outside of the pandemic, Scott, there has been a growing trend that preference for final disposition is trending towards cremation. So we're seeing more and more cremation as an option people are using. There definitely is a growing need for additional crematories, or the ability at least to modernize and expand the current crematories to have increased capacity. There obviously are environmental concerns, a lot of regulatory issues. We were able to get some of those relaxed during the height. But again, even with crematories running basically to the point where they could go before breaking down, we still just couldn't keep up. So yes, there's definitely a need for more capacity in general, and definitely in the event of a surge like we saw in the spring due to the pandemic.
That would be something, the federal funds could assist the current crematories in upgrading their equipment or even maintaining them to the proper level they should be, and even expanding their operations if we had that federal funding available, correct?
Absolutely, absolutely.
At this time, there are no questions, so I would like to go back to all the speakers and ask them to provide a 1 minute in closing.
We'll start, Mark, and thank you very much. I want to thank our guests that were with us here today. I just want to say that we hope and we pray that that we don't have the number of deaths in the second wave in any way that we saw the first time we went through the great pandemic. Of course, that will depend on human behavior, and we urge everyone to follow the proper social guidelines that have been reported by Dr. Cole, that even with a vaccine, there's still danger potentially about carrying the virus, even though an immunity might be built up inside the human body. But today's press conference is an urgent plea, an urgent call to the United States Congress. This is an SOS. This is a natural disaster. This is a mass fatality pandemic. We need a strong federal partnership, and we need it now. The Congress is debating state and local resources right now. They must come home and provide it. We believe we need this. We've made the case. The persons who lost a loved one deserve death with dignity. Thank you very much. Scott?
I would agree with that 100%. And I would agree with Dr. Cole that in order to eradicate this virus, in order to survive what's going on now, we need to use common sense. It doesn't hurt one of us to wash our hands more every day. It doesn't hurt one of us to use common sense. When you're sick, stay home. And it doesn't hurt us to stay distant from sick people and distant from people in general, especially during this pandemic. But to echo you, Steve, we do need funding, and we need money for our protection. And in turn, that protects our families. It protects our colleagues in funeral service. It protects us as medical legal death investigators to do the job that we were charged with doing, to determine cause and manner of death with dignity and respect and care and love for the deceased at all times. We have a sacred trust that we are charged with, and we want to do that as a calling, and we have to do that per statute, but we can't do it effectively without the appropriate equipment and protection that we need. Thanks.
Dr. Cole, thank you.
Thank you. Between 30 and 40 years ago, the AIDS epidemic struck the world, struck America certainly. And as a practicing surgeon, we quickly learned that the best thing to do is to use what we called universal precautions and assume that anybody that you handle surgically, and this would pertain to death investigators, coroners, medical examiners, funeral personnel, you have to assume that they might be positive for COVID, just as we used to assume that back in the 80s and 90s that everybody we took care of potentially could harbor the human immunodeficiency virus, HIV. And so we avoided contact with blood, we wore gloves, we used masks, and a lot of hand washing. And it became second nature to us as surgeons and as physicians in general. And I think this is what we're going to have to do in the future. And I think this is an attitude that anybody in this field that handles human tissue, alive or deceased, has to assume that there's a potential for COVID and take universal precautions. Thank you.
Mike?
Yes, so I think it's really important to keep in mind that despite everyone's best efforts, that no matter how long it takes to get through this, that there will continue to be deaths. Hopefully we will never see the number that we saw in the spring, but we know it's going to be more widespread. We know that it's going to hit parts of the state that may not have the same capacity that the city did to handle a lot of these things. And at some point, we are going to have to pay for what we're doing, whether it's pay for it now through some federal funding to help, or later if we have services cut because we never got the funding and the state has to still handle this. Because as we know, when someone passes away, we have to take care of them. You have to treat them with dignity and respect. You have to bring them to their final resting place. So the federal funding is really going to help us continue to do that now and not have a ripple effect of negative consequences without those funds in the future. So again, I applaud you for bringing this to everyone's attention, and hopefully someone is listening.
Thank you very much, all of you, for what you do in end-of-life care. And thank you to our media partners who joined us here on such short notice. We thought with the Congress debating this policy right now, that this was certainly newsworthy in the state of New York. Thanks, everybody. This will conclude today's webinar press conference. Thank you.